What is ceftriaxone? Ceftriaxone, sold under brand names like Rocephin, is a third-generation cephalosporin antibiotic used to treat various bacterial infections. It belongs to the beta-lactam family of antibiotics and works by preventing bacteria from forming their protective cell walls, ultimately killing the bacteria. This potent antibiotic is primarily administered via injection, either intravenously or intramuscularly, in healthcare settings such as hospitals and clinics. Ceftriaxone is notable for its long half-life, which enables once-daily dosing, making it more convenient than many other antibiotics that require multiple daily doses. What are the benefits and uses of ceftriaxone? Ceftriaxone offers several advantages in treating bacterial infections, including its broad-spectrum activity and convenient dosing schedule. Primary uses of ceftriaxone. Ceftriaxone injection is primarily used to treat various bacterial infections, including meningitis, infection of the membranes surrounding the brain and spinal cord; respiratory tract infections, pneumonia, bronchitis; skin and soft tissue infections; bone and joint infections; intra-abdominal infections; urinary tract infections; pelvic inflammatory disease; gonorrhea and other sexually transmitted infections; bacteremia, bacterial infection in the bloodstream; middle ear infections, otitis media; surgical infection prevention. Secondary uses of ceftriaxone. Beyond its primary indications, ceftriaxone may be used in specific situations such as prophylaxis before certain surgeries to prevent infections, treatment of persistent or treatment-resistant ear infections in children, management of typhoid fever and salmonella infections, treatment of Whipple's disease, a rare intestinal condition, prevention of infection in penicillin-allergic patients with heart conditions undergoing dental procedures. How does ceftriaxone work? Ceftriaxone works through a specific mechanism that targets bacterial structures vital for their survival. Ceftriaxone selectively and irreversibly inhibits bacterial cell wall synthesis by binding to transpeptidases, also called transamidases, which are penicillin-binding proteins, PBPs. These proteins are essential for catalyzing the cross-linking of peptidoglycan polymers that form the bacterial cell wall. When ceftriaxone binds to these proteins, it prevents the formation of crosslinks in the peptidoglycan layer, weakening the cell wall. This action compromises the structural integrity of the bacterial cell, making it unable to withstand osmotic pressure, which ultimately leads to bacterial cell rupture and death. This mechanism makes ceftriaxone effective against a wide range of bacteria, particularly gram-negative organisms, though it also works against some gram-positive bacteria. How to use ceftriaxone? Ceftriaxone injection, available as a powder or pre-mixed solution, is administered intravenously over 30 to 60 minutes or intramuscularly, depending on the infection. The course of treatment can consist of one dose or 1 or 2 doses given daily for 4 to 14 days. Injections can be given in a hospital or at home, with proper training from a healthcare professional. If taking it at home, ensure understanding of instructions and seek clarification from your doctor. During the first few days of treatment, keep an eye on symptom improvement. Even if you feel better, finish the recommended course of action and get in touch with your doctor if your symptoms worsen or continue. Ceftriaxone dosage. Ceftriaxone is available as a powder for injection that must be reconstituted before administration. The medication is given either intravenously, directly into a vein, or intramuscularly, into a muscle. Typical dosage instructions. For adults, the usual dose ranges from 250 mg to 2 grams per day, administered either as a single dose or divided into 2 equal doses given 12 hours apart. For severe infections, doses up to 4 grams daily may be used. Treatment duration typically ranges from 4 to 14 days, depending on the type and severity of infection. For children, dosages are calculated based on body weight, typically 50 to 75 mg/kg/day. Maximum daily dose should not exceed 2 grams for most indications. For meningitis, higher doses may be used initially. What should I do if I miss a dose? If you miss a scheduled dose of ceftriaxone, take it as soon as you remember. However, if it's almost time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for a missed one. What happens in case of overdose? Symptoms of ceftriaxone overdose may include tremor, vomiting, tiredness. In case of suspected overdose, seek immediate medical attention. Hemodialysis or peritoneal dialysis does not significantly reduce ceftriaxone concentration in the body. Treatment for overdose is primarily supportive. What are the side effects of ceftriaxone? Like all medications, ceftriaxone can cause side effects, although not everyone experiences them. It's important to be aware of potential reactions to this antibiotic. Common side effects. Common side effects of ceftriaxone include pain, redness, or swelling at the injection site, diarrhea, nausea or vomiting, elevated liver enzymes, rash, eosinophilia, increased eosinophil count in blood, leukopenia, decreased white blood cell count, thrombocytosis, increased platelet count. Serious but rare side effects. More serious side effects that require immediate medical attention include severe allergic reactions, anaphylaxis, hemolytic anemia, destruction of red blood cells, seizures, gallbladder problems, kidney stones, Clostridioides difficile associated diarrhea, severe intestinal condition, blood disorders like thrombocytopenia, neurological reactions including encephalopathy, Stevens-Johnson syndrome or toxic epidermal necrolysis, severe skin reactions. If you experience any severe or persistent side effects, contact your healthcare provider immediately. Precautions and warnings. Certain individuals should exercise caution when using ceftriaxone, and some may need to avoid it altogether. Who should avoid ceftriaxone? Ceftriaxone is contraindicated for individuals with known hypersensitivity to ceftriaxone or any component of the formulation, people with severe allergic reactions to other cephalosporin antibiotics, neonates with hyperbilirubinemia, high bilirubin levels, premature infants, neonates, less than or equal to 28 days, if they require calcium-containing 4 solutions. Conditions where caution is needed. Special care should be taken when administering ceftriaxone to individuals with history of gastrointestinal disease, particularly colitis, kidney or liver impairment, gallbladder disease, history of allergic reactions to penicillin, due to potential cross-reactivity, malnutrition or poor nutritional status. Ceftriaxone may be safe to take while pregnant. Animal studies have shown no risk, but human studies are not available. Ceftriaxone is used in low concentrations with breast milk. The medication can cause bilirubin to be displaced from albumin binding sites, putting you at risk for kernicterus. Age restrictions for using ceftriaxone. Ceftriaxone use has specific age-related considerations. Neonates, less than or equal to 28 days, contraindicated in hyperbilirubinemic neonates, particularly premature infants, due to the risk of bilirubin displacement from albumin binding sites. Elderly patients may require dosage adjustment based on kidney function. Alcohol and food interactions. No significant food interactions have been reported with ceftriaxone. The effect of alcohol consumption while taking ceftriaxone is not well documented, but generally, alcohol should be avoided while on antibiotic therapy as it may reduce the medication's effectiveness and increase the risk of side effects. Possible interactions with other medications. Ceftriaxone may interact with certain medications, potentially affecting their effectiveness or increasing the risk of side effects. Drug interactions. Significant interactions include calcium-containing products. Do not administer ceftriaxone simultaneously with calcium-containing 4 solutions, including Ringer's or Hartmann solutions, due to risk of potentially fatal particulate precipitation in lungs and kidneys. Oral anticoagulants, e.g., warfarin. Ceftriaxone may increase the effects of warfarin, requiring close monitoring. Live bacterial vaccines. Ceftriaxone may decrease the effectiveness of live bacterial vaccines. Probenecid may increase ceftriaxone levels by reducing renal clearance. Other nephrotoxic drugs, concurrent use may increase the risk of kidney damage. Additionally, a specific interaction has been identified between ceftriaxone and the proton pump inhibitor lansoprazole, which may increase the risk of drug-induced arrhythmia. How should ceftriaxone be stored? Proper storage of ceftriaxone is essential to maintain its effectiveness and safety for use. Recommended storage temperature. Unopened vials, store at controlled room temperature, 68 degrees Fahrenheit to 77 degrees Fahrenheit or 20 degrees Celsius to 25 degrees Celsius. Reconstituted solutions, refrigerate at 36 degrees Fahrenheit to 46 degrees Fahrenheit, 2 degrees Celsius to 8 degrees Celsius, for maximum stability. What happens if ceftriaxone is not stored properly? Improper storage of ceftriaxone may lead to reduced potency and effectiveness, potential development of toxic byproducts, color changes. Solutions may range from light yellow to amber depending on storage conditions, precipitation or crystallization in the solution. Always keep ceftriaxone out of reach of children and pets. Discard any unused medication after the expiration date according to proper disposal guidelines.